So welcome everyone. I think we'll get started as it's right on 12 and we have a packed schedule for you. Welcome everyone and thank you for coming to the launch of our report on social security and time use during COVID-19. As the screen says, my name is Kay Cook. I'm a professor of sociology at Swinburne University and one of the co-authors of the report, and I'll be chairing the webinar, as you probably figured out. We have a really great lineup of speakers today, and I really hope that you all enjoy, apologies, our hour together. Yeah, next slide, thanks, Kelly. So I'd like to start with an acknowledgement of country, and we acknowledge and pay respects to the past, present and emerging traditional custodians and elders of this unceded country on which we're all working today. And we also acknowledge the injustices and the trauma suffered as a result of European settlement, the stolen generations and other policies such as the forced removal of children from their families, communities, culture and land. And we respect the resilience of the Aboriginal and Torres Strait Islander community in the face of this trauma and respect their right to and aspiration for self-determination and empowerment. So in terms of the format of the next hour, I'll give you a quick overview of our report and then I'll pass it over to Professor Philip Alston, followed by responses from Senator Rachel Siewert and Carl Abrahamson. Philip Alston is the John Norton Pomeroy Professor of Law at New York University, and from 2014 until 2020, he served as the UN Special Rapporteur on extreme poverty and human rights. Philip has been critical of Australia's approach to automated welfare decision-making, which he's described as a threat to human rights. Rachel Siewert, as you know, is an Australian Green Senator for Western Australia and spokesperson for family and community services, ageing, First Nations people's issues and mental health. She's been an outspoken critic of the government's approach to welfare reform over many years. Carl Abrahamson has lived experience of receiving social security payments and will provide an account of his lived experience of receiving the coronavirus supplement. So we're really excited to have this great lineup of speakers for you, and we hope that you find their insights really thought-provoking and engaging. And the speakers will be followed by a question and answer session, and I see that Kelly's just put up some instructions of how to do that. And this will be with Philip and members of the research team and Carl. It will include our lead author, Dr. Elise Klein from the Crawford School of Public Policy at the Australian National University, and Senior Researcher and Evaluation Officer Susan Morrie from Good Shepherd Australia, New Zealand. And these two people represent each half of the community and university partnership that resulted in this research. So before we begin, I have a few housekeeping matters. So first of all, this session will be recorded and made available on the Treating Families Fairly website tomorrow, along with responses to any of the questions that we didn't get to during the Q&A. And for the question and answer session, please place your questions in the Q&A box that you'll find at the bottom of your screen. And as noted, if we don't get through all of these, we might try and group some of them, and ones that we don't get to, we'll repost our responses to on the centre website. And please avoid using the comments feature unless you're having technical difficulties, and this will come through to Kelly, who's manning that. In terms of the genesis of the report, so this was undertaken by a team of academics and community service practitioners who are members of the Treating Families Fairly Alliance. Treating Families Fairly is an alliance of child and family service organisations, peak bodies, academics advocating for policies that uphold the rights of children and families and speaking out against policies that cause harm with a particular focus on social security and welfare conditionality. And the research team would like to say thank you to Deb Savaris, CEO of the Centre for Excellence and that hosts the Treating Families Fairly Alliance, and Stella Avramopoulos from Good Shepherd Australia New Zealand CEO, who they've each endorsed our report. We'd also like to thank David Tennant, co-chair of the Treating Families Fairly Alliance and CEO of Family Care in Shepparton, for writing the foreword to our report. And of course, we would really like to thank the 173 people who took the time to complete our survey. So in terms of our research, The aim of our research was to better understand how people who relied on Social Security during 2020 experienced policy changes, specifically how the significant increase in payments and the suspension of mutual obligations impacted on people's everyday lives and time use. The study used an online survey to examine how people receiving Social Security payments used the $550 coronavirus supplement and their time as a result of the temporary suspension of mutual obligations. We were also able to compare whether these changes differed from people who did not receive the supplement, either because their payment did not include the supplement or because they did not receive Social Security payments. In late October 2020, the link to our online survey was circulated and it remained open until the 1st of December. And so before our survey commenced, it was announced that the coronavirus supplement would be reduced $300 by $300, sorry, to a rate of $250 per fortnight from the 25th of September. And while our survey asked respondents to reflect on the impacts of the $550 supplement, there was an opportunity to reflect on the impacts of this initial reduction. So the supplement was used by respondents for meeting basic needs, as well as other strategic expenditure to improve the household's long-term financial security. The supplement and suspension of mutual obligations improved respondents' physical and mental health and contributed to their overall well-being. These changes increased respondents' engagement in the labour market and other economic activities and allowed people to better engage in many forms of unpaid productive work, including care work and community support. These dramatic changes enabled people to turn their attention away from day-to-day survival and towards envisioning and working towards a more economically secure future for themselves and their dependents. So the policy changes meant that for people receiving Social Security payments, the pandemic was a period of reprieve due to the easing of financial stress, scrutiny, and uncertainty. This is very different to normative characterizations of the pandemic and associated lockdowns, which was experienced as a period of great stress and uncertainty for many people. The reduced supplement, paid between the 25th of September and the 31st of December, pushed respondents back below the poverty line. This reduction eroded the physical and mental health productivity gains achieved by respondents with the $550 supplements. Many respondents expressed dread of further cuts and expressed concerns for what the further cuts could mean to their future. Our findings indicate that the government's strategy to force people off Social Security payments as soon as possible by providing meagre support is harmful and creates barriers to employment and other productive activities. It's therefore counterproductive to stated policy goals. And with this in mind, I'll now invite our distinguished speaker, Professor Philip Olsen, to share his thoughts on the importance of economic rights during COVID.
Thank you very much, Kay. I'm delighted to be here tonight. I want to start by genuinely congratulating the authors of the report. I think it's an extremely important one. The only part of the report I don't like is the title, Social Security and Time Use During COVID-19. It suggests to me, without looking at the report, that it's going to be a reasonably dull sociological, anthropological study of how people filled in their time during the pandemic. But in fact, this is a really important empirical study looking at one of the biggest issues in welfare policy, certainly in Australia at present, but even worldwide. And it's a report that deserves very significant circulation and a lot of attention. The one, I can't resist giving a historical background because there's always a temptation to be totally in the present and think, oh my God, if it wasn't for Scott Morrison and his mates, we would have a much more progressive and different sort of debate going on right now. The sad truth is that this debate is actually centuries old. The poor law reform in Britain, 1834, was around this issue. It was an attempt to make benefits much more difficult to access, to corral people into workhouses, and to make the conditions in those workhouses as miserable as possible so that anyone who could possibly escape would do so. And if you look at historical studies in other places, I was looking recently at one in Ireland, for example, 19th century, the distinction between the Catholics and the Protestants was that the Catholics, maybe driven by their guilt, felt that anyone who was poor should be given assistance, necessary assistance. The Protestants, on the other hand, were very enamored of the deserving, undeserving distinction. And so they were much more parsimonious in their approach and happy to set up all sorts of criteria against which to measure whether someone is deserving or not. As I guess we will see later, there is also, of course, always a very strong gender dimension playing out in all these debates, no matter how far back we go. In the debates way back, the sexism is even more dramatically on show in terms of men condemning the immorality of women who produced children out of wedlock, and suggesting that this was a form of promiscuity that could only deserve punishment and should not be rewarded with benefits of any sort. We still see very strong elements of that in the current Australian debate, even if the key opponents have learned to be much smarter in terms of how they present their objections. The key thing, of course, which again was noted back in 1834 in by the commissioners looking at the reform of the poor law, they said at that point, this law would only affect a small, disreputable minority whose resentment was not to be feared and whose favor was of no value. And again, this is still an important element today. I hope that COVID-19 is going to start to change it. But I remember a couple of years ago when I was working actively on the United States situation, and I had a long meeting with Senator Bernie Sanders. One of his comments was that most of his Democratic colleagues didn't bother going and giving speeches and campaigning in the poorest areas because there were no votes for a whole range of different reasons. But it meant that the policies that were cruel towards low-income people were not sufficiently politically salient to get people agitated. Anyway, enough of the history, but I think it is important to put it into this broader context. Where we're going today is the human rights approach. The human rights approach which emerged back in the 1940s, but the real significance of it, of course, was to say that everyone, including people who are not deserving, however that might be defined, has a right to an adequate standard of living, and that governments have obligations to do all they can to ensure that that right is realized. Now, we've seen, at least in the United States, ever since Bill Clinton changing from welfare as we used to know it to welfare to work policies in the 1990s, the increasing introduction of conditionalities. And indeed, of course, Margaret Thatcher was also a prominent supporter of this approach. And the sort of sanctions that the Trump administration was trying to bring in relation to Medicaid. In other words, poor people couldn't get basic health care access unless they fulfilled all sorts of nasty requirements that conservative state governments were busily putting forth. Similarly, in the United Kingdom, universal credit brought in sanctions and conditionalities that led me to say that it was cruel and inhuman. I'm happy to say that some of the worst of those sanctions were actually lifted after the report that I did. But the point is simply that the attempt to exclude certain people, the attempt to make welfare basically punitive, is not confined by any means to Australia. Similarly, the COVID-19 moves were mirrored in the United Kingdom and the United States in terms of conservative governments saying, oh my goodness, middle-class people need welfare. We can't keep the benefits at such a low level, and we can't make the conditions so punitive. We've got to free it up for our friends. But of course, now we're seeing that that is all returning to, quote, normal. I think the important thing is for us to focus on the broader context. This report makes a really compelling set of arguments of an instrumentalist type. In other words, if your interest is objective and is to try to enhance the well-being of the community, then you will see that the sort of conditions that are imposed are just counterproductive. Even The Economist railed against these sort of conditions which went against all of the empirical evidence a couple of years ago. And so this empirical argument, I think, is very important. Anyone who is seriously concerned with economic development, with improving the overall situation, will be moved by this. But the other dimension, and my last point, relates to the relevance of ideology. And that's where what we call economic and social rights come in. It's interesting that in the United States, there is now a willingness to use terminology of the right to health, right to education, and increasingly even a right to housing. In Scotland, the government is actually making the International Covenant on Social Rights part of national law. And I think that's the next step in the Australian debate, is to go beyond what is in this study, which, as I said, is really so important, but to add that dimension to a real commitment to a different foundation for treating people through social protection systems, and that is recognition of social rights and a right to an adequate standard of living. Thank you.
Thank you, Philip. That was really insightful, and I think it will really provoke a number of questions in our Q&A that will really get into the heart of what is trying to be achieved in the policy changes that we're seeing and where the benefits lie in those changes. I'm now going to turn over to Carl, and he's going to share some of his personal reflections on the Australian social security system. And we're really glad that you could be here with us today, Carl, as these insights are really important and desperately needed to be heard by policymakers, but we can't guarantee that they're listening. So over to you.
Thanks. So I've just got some prepared notes just to keep things in order. So my start of getting into Job Seeker was a poorly timed job change ahead of the pandemic. As it stood, my role with the company likely wouldn't have lasted into the lockdown anyways, because they would have struggled to redeploy me. This was due to a medical condition that changed the duties I could fulfill within their health and safety framework. So it was kind of going to happen anyway, just really bad luck. The elimination of the wait time was definitely helpful, and that that 6 weeks, not having to wait through would have made a difference. It just helped us know that we were keeping track on our bills. So I started on Job Seeker in the 3rd week of March, and by mid-June I had been assessed and was assigned to a job services provider. The initial supplements and amounts were adequate. Focus on the adequate. I was able to focus on keeping families safe during the early months of the pandemic. I did a lot of grocery deliveries to keep vulnerable family in their homes. And that was with the advantage of being fresh from full-time work and having most of my finances in order. We were a 2-income house. And so the extra funds meant we didn't slide backwards. Had that not been the case, had I not come out of full-time position and had we been at the normal rate, the extra funds would have been really rapidly depleted. So my JSP was able to fund part of my upskill training to a Cert 4 in training and assessing, although I had to negotiate for that. And I did feel that even they were actually uncomfortable with how that dialogue really went. Neither of us really felt good. And we had enough savings that I was also able to do a Cert 4 in workplace health and safety. So a significant amount of upskill training, but all done kind of completely blind. I had to make choices and just kind of dive in and wasn't able to get a whole lot of feedback. The other thing is by the time I started those courses, the job trainer program had been started and announced, but my JSP didn't know about it. So I did it all kind of on my own besides. Communication of any changes was very poor coming from Centrelink. I had to be very proactive to keep up on anything. There was often very, like a lot of disconnect between news reports, things I heard from other people, and then what I could read for myself. Didn't really handle local needs very well. And pretty much every major change was followed by a swamped call center and a crashed web page. The Sunshine Coast, where I am, didn't really lock down very hard or have very many cases, but the job market completely collapsed. Pretty much every sector, because in that first initial wave, no one really knew what was going to go on. And even now, the regional job market is pretty sparse and it's really spread out. It's a big geographic area. And so most positions require the ownership of a car. Like the employers put it straight in the job description. You have to have your own vehicle. Some won't even say reliable transport. So as the payments were reduced, additional stresses were added as it was very difficult to predict how changes to the income levels were going to affect the payment. It makes the budgeting extra difficult when it needs to be done with several weeks of lead time and you're trying to adjust and try to prorate, when a change is going to come into effect versus when payments are going to happen, where it's all going to fall. The removal of mutual obligations was immensely helpful. I continued to job search and apply for jobs through the entire time, but there is no possible way I could have found 20 jobs a month that were within a reasonable distance of my home, that I was qualified for, or that would even be suitable. I've noticed a market uptick in jobs being listed incorrectly, that really skirt labor laws, and some of them are getting very brazen. Some are very scammy looking. And it can't be understated how mentally draining it is to see blatant lies posted on behalf of employers in the media without any voice from those unemployed, because that affects the entirety of the dialogue when you're just discussing it with other people. When someone says, well, why aren't you applying for X job? They don't realize that X job is a fiction. The entire process really seems designed to make one feel reactive rather than proactive. Feeling like making forward progress it's really important to mental health. However, the system consistently provides new hurdles to be cleared. These take up energy and have no real payoff. Over time, they quickly become onerous, and even under the best of circumstances, when under the full supplement, I could afford at least some mental health support. As soon as the first cut happened, that was one of the first things that had to go. So obviously not great. At this point in 2021, we're hitting the 1-year anniversary of the lockdown. I can see what I've accomplished, but I have really little tangible to show for it. And to be honest, I don't think I could handle going on much further. With the lowered rate, I quickly become unemployable. I want to reiterate that the higher payment didn't allow me to do any more than I did when I had full-time work. And I'm going to admit to another advantage. We are a 2-income household. That only just was enough to keep me in the employable line. It kept us with 2 running vehicles. It kept us with internet and phone and all those things. But the savings were still being depleted by all the extra, the things that come up. The system really does hurt those that need it. From talking to the people at my job service provider, it seems to hurt them too. It fundamentally fails to achieve its stated goal. I think people on their own, given the resources they need, will be productive. Some of those people may never enter the traditional workplace again, but if they can eat, have a safe place to live, they still contribute. And all of the personal improvement that I was able to do this year is kind of due to sheer dumb luck and circumstance. I already had the momentum. I knew that I had change coming before the pandemic hit. So I already had I had momentum. I had a running head start. And I'm grinding to a halt at this point. If we expect people to be able to achieve anywhere close to what I achieved in that same time frame, then the system is fundamentally broken. It doesn't provide that level of support because I'm not the norm. I had a lot of advantages to get to where I got to. And just for a few little points of reference, the single room rentals in my area, so not share houses, are greater than the 1-week normal standard payment. So if you don't qualify for any of the extra stuff, you're in a share house, which for a lot of people is really not an option. Cost of transport is huge and doesn't seem to factor into anybody's calculations. The costs of modern job hunting and maintaining employability. I need access to reliable hardline internet because I don't have good cell service at my house. I need to have reliable cell service when I'm outside of my house. I need a basic minimum of computer hardware to keep, doing courses and try to improve. I had to cover all of my own background checks, maintaining first aid certificates, driver's license renewal. All that stuff still is an expense to keep you employable. And all of the training for entry-level jobs has to be done in person. Very few, both of my training sessions that I did were, they're desk job kind of things that can be easily translated online. In a short term, to get people employed, if they can't get to a location, if that place can't hold courses in person, well, those jobs can't be trained for, those people can't enter the workforce in those capacities. And it just seems like a disconnect because, how are you supposed to get your head above water? And in the last year, 35 job, reasonable, solid, high quality job applications, 1 reply. And tomorrow we find out if it was even a good reply. But that's my 12 months in sort of summary. And hopefully that gives people a bit of perspective on what it looks like when you hit a pandemic with a running head start and all the advantages. It's still pretty brutal. I wouldn't have liked to hit it without all that momentum.
Thank you so much, Carl. It's really impactful and really important to show just how hard it is when you're probably as close as it gets to the imagined. Like, I always think that the policymakers in Canberra often think of welfare benefit recipients as middle class sort of people like themselves that are working in office jobs and have internet access at home and can engage with the world in the same way that they do as public servants and officials. And the further you deviate away from their own lived experience, the less the benefit package has anything to do with your experience, and it doesn't recognise any of the costs or the difficulties that you require to make that function. And so it's really important to get these messages out there, and hopefully they can be received, that especially as we move in this much more digitally connected world, that completely isn't recognised as a requirement of people's job search or being able to even engage in government services. So thank you very much, and hopefully you'll stick around for our Q&A session. But I can see that Senator Rachel Siewert has joined us from straight out of Senate estimates. And thank you so much for making the time to come and speak to us. And I will hand over to you so that you can share your experiences with us and what we could possibly do from here.
Okay, thank you. And I do apologise that I wasn't here earlier. I have, as Gay's just said, I've been in Senate estimates. First off, I'd like to acknowledge that I'm actually sitting here talking to you on Ngunnawal Ngambri land and paying my respects to elders past, present and emerging, and acknowledge that this is stolen land and we have a lot of unfinished business. When I sat down to think about my contribution today, I was sort of struggling to think about where to start, given that where we are at the moment is, for a lot of people, it's highly distressing, and the social security system has been distressing for a long time. But when the government announced that they were going to double the job seeker payment, the old New Start payment, I literally had tears in my eyes. Just thought, you know, they've realised that you can't live on $40 a day. And all of a sudden, people, you know, the government seemed to be understanding of people's situations. Although, of course, we have to realise that that was because they knew a lot of people that they saw as their voter base and as their people were going to be thrown onto job seeker, and they knew very well you couldn't live on $40 a day, which is what also breaks my heart even more, in that we're now gone back to the massive increase of $3.57, which is less than $44 a day for the job seeker payment. So all those years of campaigning, it's like a smack in the face that we've now gone back to $3.57 a day increase. And along with that, so when the pandemic hit, the payment was increased. Mutual obligations were still in fact going. It wasn't until the system actually really started failing in terms of, well, of course, people couldn't go out to meet the mutual obligations, but also when they were reporting through the computer system, we were just getting inundated with phone calls into our office that people weren't getting paid their job seeker payments because the system had broken down, wasn't recording people's activities, even though they'd been given an exemption. Anyway, government fixed that. And during that time, we had a lot of people that were having problems with Centrelink. And for those of you who don't know, senators and members of parliament have a liaison person with Centrelink. And we use ours a lot because we get a lot of concerns raised with us. And during that time, we managed to very rapidly be able to contact Centrelink and get a lot of help for people. Centrelink were being very sympathetic and were seeming to be able to resolve people's issues quite quickly. And that remained so for a couple of months. And during that time, we were also talking a lot and had a lot of interaction with people that were on job seeker payment. We were talking to them about how we wanted to find out how people were doing with the doubling of the payment. And I'm sure you've heard a lot of this. People were actually, some people saved a bit because they didn't think it was going to last, which was exactly the case. And then people were talking about being able to put food on the table, be able to eat properly and be able to eat nutritious food, not just energy-dense food that makes your stomach feel full. So people were talking to us about improvement in their physical health. They were also talking to us an improvement in their mental health, less anxiety about where the next meal, literally where the next meal was coming from. They talked about being able, some people then were able to, for example, buy medications that they hadn't been able to afford, because what we've heard in the past is that people skip their medications because they can't afford them, and or they preference their children for their medication. People repaired cars, which of course then means that they can, helps them look for work, etc. Undertook more training, did some self-care. So generally the doubling had a very positive effect, and that's been well articulated. But when it then came to, once we started coming out of the pandemic, we saw government basically revert to type, which is, you could see it when they started talking about job snobs, when they started demonising people for not taking work, cutting the payments back. They basically reverted to how they used to be. So we had this glimpse into how the system could actually properly support people, and then it's basically gone back to normal. They also then talk about, of course, all those extra payments people get, the majority of which is the $4 energy supplement. So it seems to me that the way government approaches this, and Elise asked me to talk about people's economic rights. Well, in my opinion, people don't have those rights if they don't have a job. That's not my opinion. That's how I see the government sees people, is that if you are unemployed, you don't have those economic rights. They're also now, of course, returning mutual obligations. They're also doing the job seeker, we call it the job seeker line, and actually now saying they're going to check people's applications to make sure that the applications for jobs are genuine. Now, when there's 9 people for every 1 job, people lose heart very quickly in terms of actually, and we just heard from Carl, they don't even get replies for those job applications. There's literally, for some jobs, thousands of people applying. So I'm not trying to be depressing, but I actually find it very distressing that we had a glimpse into what a good social security system could look like, and now we've gone back to demonising people, almost bordering on almost trying to force people to go to the bush to find jobs. The targeted compliance framework has kicked in again. I'm in estimates at 2, in employment estimates, asking questions about that. We've just got that data. People have been their payments suspended, even with the two-day grace period. We are very committed to keep campaigning for an increase in the job seeker payment. But for me, it's also, we've got to change the whole system. Yes, we need an increase in the job seeker payment, but we also need to reform our income support system. As I said, we've had a glimpse of what it could look like, how a positive, supportive process works, how the benefit of a higher payment, the benefit of not being punitive and demonising, in encouraging people to truly providing, what we should be doing is providing more wraparound services to support people at where they're at. And so I've probably filled my time now, and unfortunately I'm going to have to rush off. But if anybody does have any questions, they can email me, and I'll try and stay as long as I can. So I apologise that I'm dropping in and dropping out. I am happy to answer any questions if people have them.
Thank you so much, Rachel, for sharing your wealth of experience on this issue, and particularly because it's a parliamentary sitting day, and that's fine if you have to rush off, and you'll be sorely missed once your time in the Senate comes to an end. we're really grateful of the advocacy work you've been doing. I'm just going to quickly turn over to Elise, who's going to provide some of the recommendations and implications from our report, and then we'll move on to the Q&A session.
Thanks so much, Kay, and thanks, Rachel, Carl and Philip, so much for your thoughts and insights. I just, reflecting on all of your contributions, just wanted to link them back to some of the insights that were raised from the report. And again, just to thank all the people that engaged in the survey and provided us with this material to be able to think with. I think, you know, one of the themes that are coming through a lot is how, I mean, poverty is a complex issue, but what we're seeing here in Australia, and particularly given the experiences of COVID, the supplement being given, but also the mutual obligations being cut back, is how poverty in Australia can be thought about as being policy induced. And I think that's an important sort of point that we've seen from the responses, that people, when they were able to get the extra supplement, were able to meet basic needs. And when you look through the report, you'll see all sorts of responses of what people were able to do with the money, to be able to just keep their heads above water, but also people being able to use that money to invest in certain ways to set themselves up a little bit after COVID. So cutting back on debts that had been accrued from having low payments before that, to all sorts of economic supportive activities such as study, purchases to support getting back into the workforce when they could. But it also shows how thoughtful and responsible, of course, people are with money, and this sort of flies in the face of some of the discourse out there that suggests that people on low incomes are not responsible with money. And we see with the rise of income management, for example, a policy response that speaks to those kinds of assumptions. But in this research, we're absolutely seeing that people were extremely thoughtful with the money that came. We also, I think it's also important to acknowledge that when people moved from the $550 a fortnight to $250, so the 300 cut in income, people really started to struggle again. And so, you know, when we talk about adequacy, we really are talking around at least that $550 amount, because when people were cut back to $250, we saw those gains that people were able to make really being cut back, and people again starting to worry about issues of survival. The second thing I think this research and some of the comments already circulated is also the need to think about how we think about work, and to rethink our very sort of narrow conceptions that we often see in policy about work just being employment. Because what we were asking in the survey was not just what people were able to do with the money, the extra supplement, but also what people were able to do with their time. And this was particularly for people who had their mutual obligations cut down, and they got their time back. And people were extremely productive with their time. They did all sorts of important activities that are very important for the economy and also society. So people were doing all sorts of work, such as a lot of unpaid care work, which we know underpins the economy, often undertaken by women. So this is a very gendered finding. But also people all doing lots of community work with their time, helping others. People spoke about volunteering, caring for elderly. So a range of activities that are extremely important for the economy and society. And what this shows is these kinds of assumptions that people are welfare dependent overlook the ways in which the economy and society are dependent on these unpaid work that people who are unemployed are doing. And I think that's a really important conversation that sort of speaks to some of the recommendations that are coming from our report. I think it's also important to reflect on how these changes are affecting children. People in our research talked a lot about how, of course, they were already already looking after their children, but with the extra time and also with the extra funds, they were able to do that better, and they're able to provide better for their children. And so when we think about childhood poverty, thinking about the impacts of social security, I think are really, really important. And then the last sort of thing I just wanted to point out was just how alarming the impacts are on punitive settings of social security are on people's health, their mental health and their physical well-being. That people were able to, with the extra money, were able to able to buy medicines, they were able to feed themselves properly, and they reported their health, their physical health improving. But also they reported their psychological, their mental health improving when mutual obligations got cut and when people got extra money, that they were no longer as stressed and as anxious about, where the next meal was coming from, how they were going to pay this debt, etc., that they were able to do it, and therefore their emotional well-being improved dramatically. And I think that's also an important implication for these findings. Thanks, Kay.
Thank you, Elise. That's great. And we'll put up the link to where you can find the report and read all of those recommendations for yourself. I'll just ask all of our panel members, so if you see your name on the screen, if you can put your video back on, and we will ask people to unmute. And we have a few questions that have come in. I will ignore your congratulations, but I'll get to your question later, David. I will start with Lainey Stockman's question on why the findings of this report, well, whether they can prompt policy change, if so, how, and if not, why not? So I'll open that up for whichever of our panelists wants to begin that. Senator Siewert, you probably have some excellent insight into why this may or may not be the case. So it'd be great to get your insights first. Oh, you're just on mute.
Sorry, could you just repeat the question? There's some background noise going on here. Sorry, I've just...
So can the findings of this report prompt policy change? If so, how? And if not, why not?
That is a very good question. It should prompt policy change. We've seen through, and as I articulated, but also, as I made the comment, but also as Elise just pointed out from the findings, there was very positive outcomes from putting the payment above the poverty line. I'll note the government has made a deliberate choice to drop people back below the poverty line. They can make a choice to take people back up above the poverty line, and the sorts of research that Elise, the work that Elise has done actually supports what people have been telling us, which is their well-being improved. They could overcome what are in fact barriers to employment, which is poor health, not lack of access to infrastructure. Carl talked about being on the internet. That's one of the things that came up. In fact, there's a big push for recognition of digital rights and the essentialness of those. So it can and it should lead to policy outcome. It is actually the barrier to policy change is government. Government is, have just legislated to drop the, we call it a drop. The government says it's an increase, but it's actually a drop, of course, from what the job seeker payment was when the supplement was in place, which was double. The government has made a deliberate choice, and they can make a choice to increase job seeker, to get rid of mutual obligations, and to provide. I haven't really even touched on the Jobactive system, which is appalling. And over one weekend, a couple of weekends ago, we did a call out on Facebook for people to articulate their, if they wanted to share their experience with Jobactive. In less than 2 days, we got 700 responses from people articulating their really awful experiences with the Jobactive system. They can improve that. They invest, I think it's up to now, it's around $7 billion. We should be having a better system for the investment of $7 billion And we should be providing individual program supports, wraparound services. And, it's not hard to make a job plan, or it shouldn't be hard to make a job plan that actually is specifically suited to and addresses people's needs and aspirations, rather than the literal rubber stamp process that goes on. And if you don't agree with it within a couple of days, you get suspended. And so these are the sorts of decisions that have been made by government. They can make different decisions.
Thanks, Rachel. And
Kay, it might be interesting to get Philip's thoughts around that, at a sort of thinking at a global level, but also thinking in terms of human rights. We don't have a Charter of Human Rights here. I'm just curious about where sort of his thoughts are thinking about policy change here.
And I was going to tack on the second question to Philip as well, that because this report is very unlikely to lead directly to policy change, what are the political motivations for persisting with this low job seeker payment? So if you can take all of Elise's commentary and that question as well, and I think we know the answer to the second question, but it'll have more import coming from you. So over to you, Philip.
Thanks, Kay. Yeah, I mean, the answer to the second question is well known. This is a winner. It's an electoral winner. Screw the less well off, blame them for their own plight, ignore the actual evidence of whether these policies are working or not, and don't engage at a sort of fact-based evidence level. The first question is the more important one. How can one move beyond that, given that this is a very deliberate political strategy, which is reflected in many countries around the world, and a deliberate deafness to the sorts of studies that you have put together. Your study maps on to a lot of universal basic income studies. They, of course, have a vastly more ambitious objective in most cases, but where experiments have really been done, they end up doing much of what your study does. In other words, you give a group of particularly people who are particularly in need enough resources to be able to achieve some adequate level, and you demonstrate that, in fact, rather than spending that money on alcohol or gambling or whatever, it goes to very good use. One of the big problems, of course, is the media. I look fairly regularly at the Daily Mail because it's important to know what the opposition is doing. They are as poisonous as the Murdoch media. And yesterday's story with the checks coming out in the US from the stimulus was based in Las Vegas, and it was all the people who had gone to Las Vegas to spend their stimulus checks. And the message is, we're mad to be supporting this additional set of welfare payments because it's just going to be gambled away. And the media never misses an opportunity to misrepresent this sort of impacts that you have documented very carefully, and instead to find the tiny percentage of people who, like in every other area, are not behaving with any wisdom. I don't know what the role of economists is in Australia. I know there are a number of think tanks that are trying to influence economic policy, but at least over here you've got a group of progressive economists that have a big media profile, like Paul Krugman, Joseph Stiglitz, and various others, and they would certainly consistently pick up on these sorts of studies and hammer them home. And there's no magic bullet. It's not, no conservative minister is suddenly going to wake up and say, oh my God, I didn't realize we could do this better. It's a question of just gradually building up public understanding that, in fact, the policy is based on a scam and that it could be done dramatically better, probably even for less cost. but certainly for the same cost if they wanted to do that.
Thanks, Philip. And veering off into a more specific area of this, David Tennant is asking about the alleviation of child poverty that occurred as a result of the supplement, and now that that's being reduced back down to a very low level, and how that can be reconciled with national commitments to the prevention of the abuse of children, and casting this in a broader light, of viewing welfare policy as perpetuating or even instigating sort of structural abuse of children on an industrial scale. And I'll put that open to anyone who would like to jump in on that. Just feel free to unmute.
Yeah, I actually, my past position was in childcare. I did school camps and things like that, and hugely rewarding work. And one of the greatest things was getting kids from the lower socioeconomic schools to get experiences that they couldn't afford in the, I guess, quote unquote, private, entertainment sector. We get plenty of private schools where we couldn't impress the kids because, well, they've done that in Vanuatu and Bali and all that sort of stuff. And then we get these state school kids who, haven't seen that big of an area of green grass or that many trees in the same place in their entire lives. And when you see those impacts, parents want to be giving that to their kids. Parents want to be sharing that. But if they don't have the skills themselves to understand how to get the best experience for their child, and they need that help, then they need, it's just a matter of cost. They can find somebody who can help them give their kid that, more enriching experience. And unfortunately, it just doesn't happen. If it has to fall entirely on the not-for-profit sector, there's a lot of kids who are going to fall through those cracks, because the number of kids that their parents, believe that, hey, that private school is going to get them the advantages they need to crawl out of wherever. Well, that kid probably doesn't also have the money for those extra fees, and that 1 week at camp is probably, that's going to be the thing that has to slide by the wayside, when legitimately it may actually be the thing that kid really needed to, find their self-confidence, find their own identity, find an environment outside the classroom. And so you end up in these odd situations where, you've got private school kids who can't get out because they don't have the funds, and state school kids who don't get out because the valuation isn't there, because the parents just have other priorities for that money.
Hey, could I just very quickly, one sentence, say that, of course, there's a parallel with, in response to your question, with violence against women, that if you are providing much lower assistance to the family, you can sit back and you can just, it's like watching laboratory mice. The kids are going to suffer hugely in different ways, and the women are going to be also the subject of violence, because you've generated immense tension that didn't need to be in the home, and that takes itself out on the less strong.
And they probably don't have all that much super to draw out.
On that violence against women point, there's people in the report that talk about how Centrelink and having to do mutual obligations is like escaping from a violent, one person's talking about escaping from a violent partner, then having to re-engage with mutual obligations, which was like a violent relationship with the state. And so she's drawing a complete parallel there. So yeah, just to echo the points already made.
It's Rachel. We've found the same in the comments. Women have made similar comments to us in feedback on mutual obligations. I was just asking in estimates about the number of people or the number of children in that whose parents got FTB and the coronavirus supplement, and there's just over 1 million children. So straight up, when the coronavirus supplement is gone, those 1 million children aren't getting access to that additional funding. So it going backwards like we've gone has a dramatic impact on children living in poverty.
Yeah, I think it's a really depressing point to end on, but unfortunately we're going to have to end our discussion there as it's 1 o'clock. So I'd really like to thank all of our speakers today and all of our panelists, and thank you all so much for coming and for your questions. We'll put the answers to the questions we didn't have time to get to on the website, and you'll be able to find a copy of the report there. Kelly's just putting up where you can find that. And so thank you once again to everyone. It's been really inspiring to hear what's being done and how this issue can be thought about, and depressing at the same time that we really need to get some traction in the public, with the media, and in Parliament. So hopefully we can all be part of that occurring. So thank you everyone, and enjoy the rest of your day.